In this video, we'll see how to manage non-surgical cases and how the balance calculation will flow. We have entered the username and password which is provided to all the health facilitators. Press login or press enter. When the patient approaches the health desk with their health card, we have to enter the health card here and then choose the medical if they are coming for certain medical treatments. Search, we have searched the family. This card is from KPK project. It means every individual member of the family has this benefit limit. For the sake of CR it is 30,000 and for Seema baby it is 15,000 and Vajiha 30 and so on and so forth. We're going to treat CR here. We have to click on one thing please. If we have less than the allocated balance of 30,000, then we can see the history, what was the previous treatment and when it was. Now today we are going to treat CR and we have to click reference letter here. This is the reference letter generated. 1777810 is the visit ID and this is the date and card number and all the details are in here. We have to get a printout of this reference letter so that the patient or the attendant can carry it to the hospital designated doctor. This one entry is for particular attention if there is a case of non-surgical. It is expected length of stay, days. This has to be filled in by the hospital doctors. When the patient has gone to the hospital doctor filling in the reference letter, we can exit from this screen and can attend other duties over the desk. Now this 1777810 is appearing in checkup tab under this visit ID. When the people with this visit ID are approaching back to the health desk, we have to double click it for the interaction for further processing. Now the hospital doctor has advised admission for sake of argument 2 days. It is pre-admission and the presenting complaints will be added in here, like infected wound on right foot. This is the presenting complaint. Infected wound on right foot, and then the history, whatever the history has been written. KC of DM, whatever the doctors have written in. Examination, it is 80 per minute was the pulse, and then 20 per minute is the respiration, and 100 is the temperature, and 110/70 is the blood pressure. Investigations recommended by the doctor is BS or whatever the doctor has written in. Initial diagnosis, diabetic foot, DIAB, foot. And whoever the doctor designated by the hospital for this task, if it is present in your desk, for the sake of argument we are going to use Dr. Sadaf. Dr. Sadaf Khan. Okay. Save and move on to the next screen. This screen depicts the details of the head and the patient. In this case it is the same. And then we have the treatment cost over here. We have to start with the coverage. It is secondary. And then whenever we have to choose the non-surgical cases, then we have to press M for medical general ward. All the treatments for non-surgical cases are grouped under this description of medical general ward. We have to choose it for all kinds of non-surgical cases. Okay, and then the list of non-surgical treatments will appear for which this particular hospital has agreed rates with State Life. In this case, this hospital has only one non-surgical. Okay, then this ELS is very important. It shows expected length of stay, which we have earlier discussed in this treatment, whereby the hospital's doctor will put in the expected length of stay in days. We have to use this expected length of stay as described by the hospital doctors to fill in this expected length of stay. You can see that per day cost is 2000. There is no transportation cost, as KPK project has no transportation cost, and then the claim amount is appearing 6000, whereas this is the first day of admission, but we have to calculate this amount so that we know what the actual expected outcome would be. This is very important for calculation of balance or remaining balance. Now, in case the hospital doctor has advised for 2 days, we can change it to, whenever we enter or click somewhere else, all the calculations will change. In this case, it has changed to 4000 rupees. Now, to calculate some other maneuvering, if this was decided initially, then the hospital doctors decide a few hours later that this patient needs surgery, then we have to add the surgery in here. Sake of argument, whatever it was, general surgery list, any other surgical treatment. For the sake of argument, it is this. Okay, now you can see that the previous cost of non-surgical has turned into 0, and this remaining balance is transported to this initial balance, then the cost of this treatment, and then the remaining balance. All the calculations are being done in here. Ideally, it would have been better to delete the previous, which was not required now, and then to add the new treatment. However, we can delete it here. Yes. Now it is very rightly in here. 30,000 was the opening balance, 25,000 is the cost, 5,000 remaining, and then 25,000 is the claim amount. But this is just the maneuvering of the balance calculations. However, we are going to deal with the non-surgical cases in this particular example, right from the admission till the discharge. So for that matter, we have to delete this treatment as well. Then we have to again secondary medical for non-surgical treatments. Okay, then non-surgical treatment, then it is 3 days. Okay, 6,000. It is the expected length of stay. If tomorrow we see this case, there will be actual length of stay equal to 1. This is automatically calculated, and it appears over here. As the days pass, every day 1 day will be added till the day 3. It will remain 6,000. However, on the time of discharge, if it is discharged today, then the calculation will be automatically switched to 2,000 rupees only, not the 6,000. Claim amount would be 2,000. Or if it comes to 4th day, then this 3 day will remain in here, but the actual calculations would be rupees 8,000 based on this actual length of stay into the cost, which is 4 days into 2,000 rupees equal to 8,000 rupees. These all things will be automatically calculated and placed in appropriate columns. We have to save, and before saving we have to enter the admission case type. It's emergency in this case. Then who is the attendant, CR, and mobile number, whatever the mobile number is. We have to provide exact an actual mobile number with the actual relation, otherwise it will create cumbersome problems for us. Now the date format already discussed in previous videos. Today is 3 days for 7/07/04/2017, and then the status, we are going to admit this person for non-surgical care. Okay, all these things are filled in here. Now we have to save it, and then comes the printout of case sheet. Case sheet will bear all the details: 1777810 visit, and then the patient and head of family, and this is the patient, NIC, head, whatever the relation, married, male, secondary, non-surgical, that is 2000, and claim amount is 6000 in here. Whereas the cost is, this claim amount is expected, anticipated. Admission, this is the history of this patient, and this is the history of other patients from this same family. This will help the doctors to know what other diseases were present with this family or with this patient and previously treated by this program. We have to get a printout of this, and then both the documents will be sent to the hospital authorities. They will admit the patient, and proper treatment or management is given to the patient for their good health. Now this patient is admitted. Up till death we have completed the task. Now we can exit and attend our other businesses. But whenever this patient needs a discharge or any other treatment or any other dealing, we have to look for this patient not in the checkup tab but inpatient tab. This is appearing in here on the top, 1777810. This is our case sheet. This is our case sheet, and reference letter, both are showing this. This is the unique ID of this patient for this particular visit. Now if you want to have a look at it, you can go through it and you can change it whatever you want to, all the calculations there, and then exit. And if you want to discharge this patient, you can discharge it by clicking this button. Before this discharge, the DMO would have gone through the case and would have discharge planned. All the particulars will appear in here, and if he has done the case management, a surprise visit or whatever, all the things will appear in here. But it is not the relevant case for this particular video now. Final diagnosis was whatever, XYZ, and discharge doctor was Sadaf, and what type of discharge it is. It's normal discharge, and nothing will appear under here. Just for the sake of argument, it would change to some other. If it is died, then you can see the funeral of rupees 10,000 will appear in here. All these are dynamic. If it is any other case, or if it is more than 1 day, then it will calculate the wage loss, which is up to 3 days wage loss. And if it is maternity case, then the maternity cost would be here, and then the referral letter would be here. You have to come back again to this for proper calculations. This, whatever the final diagnosis is, and then the discharging doctor is Sadaf, and then the type is normal, and nothing is appearing over here because this has no transportation cost or whatever. Nothing has been paid. Yes. Okay. Then 5 days medical treatment, post-discharge medicine is also given to the patient. Whatever the medicine, we have to enter it here. Syrup, for the sake of argument, whatever syrup, quantity once a day, and then another drug drops, whatever drops, and then one, and then when needed. All these things are filled in here, and then comes the patient feedback. Whatever their feedback is: hospital staff behavior, good; hospital treatment, good; hospital cleanness, good; state life behavior, very good. And if there is some reason of dissatisfaction, then we can put in here, and comments for improvement can be put in here, and the patient's mobile who is providing these feedbacks, and then save, and then comes the discharge. This is the discharge printout, discharge slip printout. You can print it in. All the feedbacks are provided in here. Nothing is paid in shape of this transportation charges, and patient's attendant or patient signature will be put in here, and the hospital will put their signatures over here. Now coming back to the inpatient, it's not in here. Now the visit has moved to discharge tab. It is 1180, this amount, and claim lodging. You can see that there is it is appearing over here, visit ID with the appropriate amount, and this case from lodge to discharge has been completed. Thank you.